A World Health Organization official has revealed the transmission of the novel coronavirus has mainly come from people showing symptoms, and it appears patients without symptoms have not been driving its spread. Dr. Maria van der Kerkhove said although they are still looking at the data, it appears to be rare that an asymptomatic person actually transmits onward to a second individual. Detecting and isolating infected people with symptoms would drastically reduce the transmission, the official said.
This morning, new confusion about how the coronavirus spreads after a bombshell assertion by the WHO Monday suggesting transmission from patients who do not show symptoms is actually not very common.
From the data we have, it still seems to be rare that an asymptomatic person actually transmits onward to a secondary individual.
That directly contradicts current guidance from the CDC, which says the virus can spread from person-to-person contact even if the carrier does not have symptoms, a critical reason why the CDC recommends social distancing. The mixed messages leaving many frustrated as they try to protect themselves.
I feel like I don't know who to turn to get the truth.
We don't know who to follow and what to do at this point.
One unified voice giving us clear instructions on what to expect and how to keep each other safe would be most helpful.
The WHO epidemiologist who made the statement later explaining herself on Twitter, saying pre-symptomatic patients, those who show no initial symptoms, are a transmission risk, whereas asymptomatic patients, those who never show symptoms, are much less likely to transmit the virus.
This message from WHO, I think, was just a bit of a disaster because it caused so much confusion.
Dr. Ashish Jha is a professor of global health at Harvard University.
The bottom line is this. There are lots of people with infections who have no symptoms who are spreading the virus and getting other people infected. So that's why people have to wear masks. That's why people need to practice the social distancing.
We did reach out to the WHO and CDC for clarification, but have not yet heard back.
So there's a couple of things in the question that you just asked. One is the number of cases that are reported that are being reported as asymptomatic. And so we hear from a number of countries that X percentage of them are reported as not having symptoms, or that they are in their pre-symptomatic phase, which means it's a few days before they actually develop severe symptoms. In a number of countries, when we go back and we discuss with them, one, how are these asymptomatic cases being identified? Many of them are being identified through contact tracing, and so which is what we would want to see, in that you have a known case, you find your contacts, they're already in quarantine, hopefully, and some of them are tested, and then you pick up people who may have asymptomatic or no symptoms or even mild symptoms. The other thing we're finding is that when we actually go back and say how many of them were truly asymptomatic, we find out that many have really mild disease, very mild disease. They're not quote-unquote COVID symptoms, meaning they may not have developed fever yet, they may not have had a significant cough, or they may not have shortness of breath, but some may have mild disease. Having said that, we do know that there can be people that are truly asymptomatic and PCR positive. The second part of your question is what proportion of asymptomatic individuals actually transmit. So the way that we look at that is we look at these individuals need to be followed carefully over the course of when they're detected and looking at secondary transmission. We have a number of reports from countries who are doing very detailed contact tracing. They're following asymptomatic cases, they're following contacts, and they're not finding secondary transmission onward. It's very rare. And much of that is not published in the literature. From the papers that are published, there's one that came out from Singapore, looking at a long-term care facility. There are some household transmission studies where you follow individuals over time and you look at the proportion of those that transmit onwards. We are constantly looking at this data, and we're trying to get more information from countries to truly answer this question. It still appears to be rare that an asymptomatic individual actually transmits onward. What we really want to be focused on is following the symptomatic cases. If we followed all of the symptomatic cases, because we know that this is a respiratory pathogen, it passes from an individual through infectious droplets. If we actually followed all of the symptomatic cases, isolated those cases, followed the contacts and quarantined those contacts, we would drastically reduce. I would love to be able to give a proportion of how much transmission we would actually stop, but it would be a drastic reduction in transmission. If we could focus on that, I think we would do very, very well in terms of suppressing transmission. But from the data we have, it still seems to be rare that an asymptomatic person actually transmits onward to a secondary individual.
Tanzanian President John Magufuli has dismissed coronavirus tests being used in the country as faulty after they returned positive results on samples taken from a goat and a pawpaw. Magufuli, whose government has drawn criticism for being secretive about the outbreak, said the COVID-19 tests had been imported from abroad and that he had asked the security services to check their quality. They had randomly obtained several non-human samples, including from a pawpaw, a goat and a sheep, but assigned them human names and ages. The samples were then submitted to a laboratory with, according to Magufuli, the goat and pawpaw testing positive. At an event in northwest Tanzania, Magufuli said this showed that some people were being told they had the virus when they had not been infected. The president also said he was sending a plane to collect a cure being promoted by Madagascar's president. The herbal mix has not yet undergone internationally recognised scientific testing. As of Sunday, Tanzania had 480 reported cases and 17 deaths, though unlike most countries on the continent, Dar es Salaam sometimes goes for days without providing more information, and the last update was Wednesday.